Dr. Carlson, tell us about heel spur. What is it? And, how do we know we have it? And what are the symptoms? And how can you cure it? All that stuff. There's so much out there about it. And I think there's many of us who might even have it and don't know we have it. And just write it off for old age, or I don't know what it is. But tell us all about it.
Okay. Actually, heel spur, or plantar fasciitis, what it is actually the plantar fascia is the main ligament on the bottom of the foot, and it attaches from the heel to the ball of the foot. When a person steps down and walks, that arch flattens, and that fascia pulls from the heel by stretching. Some of the symptoms patients struggle with are actually when they get up in the morning, first step in the morning, they put their foot down, it kills them. It hurts, they limp, they walk around for a little while, and then the pain goes away. Then they go on about the day, they keep walking again in the evening, they sit down, they watch a little TV, go on the computer, they get up, they can't walk, their foot is killing them. So, as I said before, it's actually a main band of tissue that supports the foot on the bottom, and when a patient's arch collapses, that fascia stretches and pulls from the heel. Now, if someone has that for a long period of time, actually a bone spur grows on the heel, hence what we call a heel spur. In the past, we used to actually remove the bone spur because we thought that was the etiology or the cause of the problem, which as years have gone on, we have found that is not the cause of the problem. The main cause of the problem is actually the arch collapsing and putting that tension onto the heel. So once the arch is supported, this process tends to go away. So when we do treatment for heel spur, you must really treat it twofold. You have to treat it, number one, you have to support the foot so this problem doesn't reoccur, and then you need to get rid of the inflammation that is there in the heel, so you get rid of the pain. And ways that we get rid of inflammation in the heel would be injections, physical therapy, medication by mouth, anti-inflammatories, and then again, support the foot. Good ways to support the foot are, of course, the custom orthotics, proper shoe gear, a good pair of supportive sneakers with some cushioning, and really shoes all the time, not to walk barefoot, because anytime that arch does collapse, that's causing potential pain and problem.
So let me ask you, Dr. Carlson, when you say arch collapse, are you talking flat feet? Is the thing which we call flat feet?
Absolutely. Flat foot is the main cause of the problem.
Well, that was simple. I see.
Yeah, very simple. Flat feet is the cause.
So heel spur is flat feet.
And actually, some patients say, oh, I have an arch in my foot. Look when I'm sitting down, I have an arch. As soon as they step down, their arch flattens out, and that's really when the problem is occurring. So when we actually examine a patient, we always examine the arch on weight bearing and off weight bearing, and you'll always explain to them, look, there is an arch here, but look, when I simulate weight bearing, your foot collapses, and this is how the fascia pulls, and this is why you're getting the problem. So they must really look at their feet when they're stepping down, because that's when they see they have no arch.
When I was a kid, and you're running around in a swimming pool, I do remember. I don't know if it was one of my aunts or my parents, but they would look at the footprint we kids left after walking, after being wet, not super wet, but like wet. And you walk on the concrete, and if there wasn't two parts of the footprint, they said, hey, you have flat feet. We need to do something about it. Did you think there's anything to that?
Yeah, well, actually it is. When you step down, you can